Hi, everyone. Thank you for attending our presentation today. Our presentation is titled Telling Your Mental Health Story, Creation and Assessment of a Safe Storytelling Toolkit. My name is Romaisa, and Isiah will be doing second half of the presentation. So what is storytelling? Storytelling is a powerful tool utilized in the therapeutic context to assist individuals as they explore and develop an understanding of and take ownership over their personal experience in relation to their mental ill health. Storytelling relates to mental health as the process of sharing stories can allow individuals to gain a deeper understanding of their experiences by making links between their sense of self, temporality, social standing, and morality, thus helping with their mental health journey. Studies suggest that storytelling, in conjunction with other interventions, can be helpful in reducing symptoms and increasing functioning. Also, sharing of mental health experiences can help to destigmatize mental health struggles and provide voice to people with mental illnesses. Although storytelling events are commonplace in the local community, there's limited research surrounding the understanding and investigation of what makes a safe story and what makes it safe to hear in these public formats. This study aims to address this gap by the following 3 steps. First, to develop a collection of guidelines and recommendations to be used for the creation and sharing of stories focusing on mental well-being by an interdisciplinary working group consisting of youth, community members, and researchers. Second, to examine how former storytellers, listeners, and local organizations involved in hosting mental health storytelling events define safe storytelling and what outcomes the process of telling and or receiving a story had on them. For the third step, it's to develop a comprehensive storytelling toolkit based on the qualitative data collected through the interviews and focus groups. For the methods, for step 1, we used a very iterative and collaborative process to develop the initial draft of the storytelling toolkit. For the second step, in order to learn more about the community's perspective on storytelling and the benefits of the toolkit, we aim to collect qualitative data through focus groups and interviews. And for the final step, we want to collect the feedback from various individuals in the community and use it to inform the final version of the toolkit. Following the final iteration, the toolkit will be prepared for use and we will partner with community storytelling organizations to distribute it.
And here we have an outline of the toolkit as it stands now, its different topics, and the different material that it goes over. And I'll give you a moment to look that over. So the results from this work really is the toolkit that we've worked so hard to develop, but also the qualitative data that we've collected throughout the research process and through the various interviews that we've conducted, both with storytellers, story receivers, and with storytelling organizations. The next steps for our process is to adapt the toolkit into different languages, as well into different forms of narration to reach a larger audience. So things like videos and audio rather than pure text, and different languages to meet different communities. It really is about making the toolkit as accessible as possible. We also hope to synthesize the data into a paper independent of the toolkit so it can be accessed separately. This will allow the broader research community to get access to the wonderful insight that we were able to collect from all the individuals that we spoke to. We also hope to pilot the toolkit and to collaborate with some of the organizations that we've been in contact with to get direct feedback on its integration into their process. To conclude, what we're really hoping our finalized research will do is advance the knowledge and understanding of the conditions under which storytelling can be considered safe, to inform those gaps that exist in the current practice and policy that communities and organizations are using in their storytelling, and to provide individuals with assistance in their journey of sharing their mental health story and accessing the resources that both the audience and the storyteller may need throughout that process. And above all else, we want to allow more people to tell their story and be sure that they do it safely. Thank you for your time. We hope you enjoyed.